Now that we've finished our exam, we can leave the probe in the patient for monitoring immediately in the next hour or so, or we can take the probe out and put it in the storage sleeve where we can use it the next day. The first thing we want to do is on the handle, take this notch here or lever and pop the cartridge off, and we'll take the handle and place back on the machine. And then it's very important to make sure that these pins are covered so that they don't get damaged. And again, we just snap this cover on and we're well protected. If we decide to leave the probe in the patient, most of these patients are intubated, so we can take a piece of tape and just secure it to the endotracheal tube. I usually like to leave the probe in about 40 centimeters or so. I try not to leave it right in the esophagus. I usually like to get that back in the stomach, and as we said, the GE junction is about 40 centimeters. So 40, 42 centimeters or so should be fine. We don't have to use a lot of tape to tape this probe in. Basically, we just want to keep it in somewhat position so that it really doesn't get pulled out. And I like to take the tape and fold the end here so that when we come back in, we can very easily remove the tape. And I take the probe and just gently tape it to the endotracheal tube, and we're ready to go. If we decide to take the probe out, and you can see how easy this is once we just grab the tape and untape it. We simply pull the probe out. And as you recall, we have our storage sleeve that I've taped over here on the wall. We can just place that in that sleeve. And we have a nice clean area to store our probe until we use it the next time.